Hello, I was just noticing that His Excellency Jayaprakash Mehta. Right, sirs, may kindly see.
Hello and welcome to WHO in Geneva. I'm welcoming you to today's virtual press conference on global health issues. It is Thursday, 5th March, and we at the headquarters in Geneva. We will specifically talk about global health issues at all, but also including the progress on cervical cancer elimination, and we'll be joined by senior officials from India and South Africa. We'll have updates on the WHO acceleration plan to stop obesity, and of course, we will also tackle the health implications of the Middle East conflict. For the journalists online, please make sure that you identify yourself clearly. We will not be able to take questions if you don't put your name and agency clearly into the system, and please raise your hand with the raise your hand icon once it's time for questions and answers. Now let me go to our panel today. First of all, we have Director General Dr. Tedros Adhanom Ghebreyesus. Then we'll have Dr. Jeremy Farrar, Assistant Director General for Health Promotion and Disease Prevention and Care. We have next to the Director General, Dr. Kate O'Brien, Director for Immunization, Vaccines and Biologicals. We also have Ian Clark, the Incident Manager for WHO's Emergencies program. To his side is Dr. Teresa Kasayeva, Director Department for HIV, Tuberculosis, Hepatitis, and Sexually Transmitted Infections. On the far other end, we have Dr. Luz de Regil. She's the Head of Department of Nutrition and Food Safety. Now, we also have three very specific and special guests, and I'm very glad to be able to welcome them. We'll have His Excellency Jagat Prakash Nadda, the Minister of Health and Family Welfare of India. We also have His Excellency Dr. Aaron Motosaledi, the Minister of Health of South Africa. And we're also very happy to welcome our Regional Director for the WHO Eastern Mediterranean Regional Office, Dr. Hanan Balkhi. Welcome to all of you. And now over to the Director General for the opening remarks.
Thank you, Christian. Good morning, good afternoon, and good evening. And a special welcome to our guests today, His Excellency Mr. Nadda, His Excellency Minister Moswalidi, and our own RD Hanan Balkhi. You will be hearing from them in a few moments. Today, WHO is providing an update on 3 diseases where we are supporting countries to use powerful new tools to prevent disease and save lives: obesity, HIV, and cervical cancer. Yesterday marked World Obesity Day. Obesity is one of the greatest health challenges of our time, but it's a challenge that we have more and more tools to address, including GLP-1 therapies. In December last year, WHO issued our first guideline on the use of GLP-1 therapies for treating obesity in adults. Medication alone will not reverse obesity, but it can help as part of a comprehensive approach that includes healthy diets, regular physical activity, and support from health professionals. The guidelines generated significant global attention and interest from countries who want to integrate GLP-1 therapies into obesity care. WHO is supporting them to do that. And yesterday, colleagues from WHO published a paper in the Lancet Global Health on our work to prepare health systems in 12 countries to strengthen obesity services, including GLP-1 therapies. Through the WHO Acceleration Plan to Stop Obesity, we're supporting 34 countries representing 1.3 billion people to reduce obesity prevalence across all age groups by 5% by 2030. Many countries are taking action, from taxing sugary drinks to integrating obesity care into primary healthcare system. WHO calls on countries to scale up the use of all tools to prevent and treat obesity at all ages. One of the other defining public health challenges of the past 50 years is HIV, but it's also one of the defining public health successes. Once a death sentence, HIV can now be controlled with safe and effective medication. As a result, the number of annual AIDS-related deaths has dropped by 70% in the past 20 years. In recent years, the same medicines that are used to treat HIV infection have also been used to prevent it in people at risk. Last year, a new medicine was approved for the prevention of HIV, lenacapavir. That's the most important development in addressing HIV since the first antiretrovirals were approved almost 40 years ago. Lenacapavir is not a vaccine, but it's the next best thing, a long-acting antiretroviral taken once every 6 months by people who are HIV negative, but at risk of infection. In trials, it has been shown to prevent almost all cases of HIV in those at risk. In July last year, WHO published guidelines on the use of lenacapavir, and in October, we pre-qualified it. The WHO stamp of approval that gives the green light to the Global Fund to buy the medicine and begin shipping it to countries. It's the first time WHO has developed pre-qualification and guidelines in parallel, not in sequence, to speed up equitable access to innovative new tools. In the past 8 months, WHO has supported 9 countries to roll out lenacapavir to people at risk of HIV, and these countries are Eswatini, Kenya, Lesotho, Mozambique, Nigeria, South Africa, Uganda, Zambia, and Zimbabwe. In October last year, South Africa's national regulator became the first in Africa to approve lenacapavir and only the third globally. In his State of the Nation address last month, President Cyril Ramaphosa said that South Africa is planning a massive rollout of lenacapavir. And just today, South Africa announced that it plans to manufacture lenacapavir locally. One of the challenges we face is that demand is outstripping what countries have ordered from donors who buy lenacapavir from manufacturers. WHO is working with countries, donors, and manufacturers to meet this demand. Another powerful tool that's changing the face of public health is the HPV vaccine, which together with screening and treatment is giving the world hope of eliminating cervical cancer. Yesterday was HPV Awareness Day, drawing attention to a family of viruses that are responsible for several cancers, including cervical cancer. In 2018, I issued a global call for action to eliminate cervical cancer, which was followed in 2020 by a global strategy with the 90-70-90 targets. 90% of girls vaccinated, 70% of women screened, and 90% of women with cervical cancer or precancerous lesions treated, all by 2030. Since then, Nearly 60 countries have introduced HPV vaccination, and 162 countries now include the vaccine as part of their national immunization schedules. Today, we're proud to celebrate two countries that are making major progress toward cervical cancer elimination: India and South Africa. Last week, India announced the largest free HPV vaccination campaign in history, targeting almost 12 million girls aged 14 every year. More than 127,000 women in India are diagnosed with cervical cancer annually, and about 80,000 women die from the disease. I commend Prime Minister Modi and the government of India for their leadership on this critical issue. To say more, I'm delighted to welcome India's Union Minister of Health and Family Welfare, Minister J.P. Nada. Minister, congratulations and thank you for making the time to join us today. And you have the floor. Namaste.
Excellency, Dr. Aaron, my esteemed colleague, Director General of World Health Organization, my esteemed colleague, Dr. Tedros, colleagues, friends from media, good evening and namaskar. It is my pleasure to address the press conference on an important theme of elimination of cervical cancer, along with other pressing global health issues. I represent a nation where health and dignity of every woman is not just a policy aspiration, but a solemn national commitment. Today, I would like to share with you the landmark measures India has taken in its relentless fight against the devastating yet preventable cancer, cervical cancer. Cervical cancer remains a formidable public health challenge, both globally and in India also. Recognizing the gravity of this issue, India has committed itself to a comprehensive strategy aimed at reducing the burden of cervical cancer. These strategies include: first, screening for the cervical cancer is now available at 181,000 Ayushman Arogya Mandirs, which we also call as health and wellness centers, across the country as a part of population-based screening for early detection and treatment. Over 86 million women have been screened under this initiative. Besides, state-of-the-art hospitals in the country, establishment of daycare centers has taken cancer near to home for citizens. This platform provides me an opportunity to share with you a milestone that marks the chapter of India's first against cervical cancer. And that is on 28th February 2026, Honorable Prime Minister Shri Narendra Modi ji launched the nationwide HPV vaccination campaign, targeting 12 million eligible girls aged 14 years. India has joined the community of 160 countries in global fight against the cervical cancer. This vaccination campaign is being carried out over 90 days and follows a single dose schedule as recommended by World Health Organization and the National Technical Advisory Group of Immunization. The vaccine is provided free of charge at designated government health facilities, Ayushman Arogya Mandirs, community health centers, sub-district hospitals, district hospitals, and government medical colleges and hospitals, in the presence of a dedicated medical officer for management of adverse events following immunization, if any. After the campaign, HPV vaccine will be fully integrated into India's universal immunization program and continued at the government health facilities during routine immunization days. Leveraging digital technology, Government of India has developed a digital UWIN platform which captures end-to-end records of all vaccinations under Universal Immunization Program, which provides for administration of 11 vaccines for 12 vaccine preventable diseases to all eligible children and women in the country. HPV vaccinations will be recorded on UWIN platform, and vaccine stocks and logistics will be managed and monitored through EWIN system. The HPV vaccination is entirely voluntary, and parental consent is a must to align with the community value systems. Transparency and countering misinformation and overcoming hesitancy by underscoring the long-term benefits of the youth of the country is another key component of this campaign. However, we need to remember that vaccination alone will not suffice to eliminate cervical cancer. Screening and awareness must continue. So a comprehensive strategy integrating vaccination, screening, and timely treatment offers the most efficacious path forward. By aligning our national efforts with global cervical cancer elimination goals, we are not just providing medical intervention, we are securing the core resilience of our society. Together, let us protect our future generations, uphold the dignity of our women, and succeed in our fight against cervical cancer. Thank you very much for giving me a patient hearing. Thank you.
Thank you, Minister Nada, and once again for your leadership and time. And WHO looks forward to supporting you on this journey. Now to South Africa. I referred earlier to President Ramaphosa's State of the Nation address last month, in which he announced plans for a massive rollout of lenacapavir. In the same speech, he also committed to ensuring every girl between 9 and 14 receives an HPV vaccine. WHO is supporting South Africa to develop a comprehensive national strategy for cervical cancer elimination. To say more, I'm delighted to welcome South Africa's Minister of Health, Minister Aaron Mashwaledi. Dr. Mashwaledi, thank you for making time to join us today, and you have the floor.
Yes, good day, Excellency, the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, my colleague, the Minister of Health from India, Excellencies, ladies and gentlemen. Thank you very much for this opportunity. Cervical cancer is preventable through the vaccination of girls between the ages of 9 and 15 years, preferably prior to sexual debut. It is also curable if detected early, yet it remains the leading cause of cancer death among South African women, with over 11,000 cases and nearly 6,000 deaths annually. Given such a high rate of mortality and morbidity, South Africa will strengthen and accelerate the implementation of the strategy for the elimination of cervical cancer for South Africa. As the Director General has already said, the President of the Republic of South Africa, His Excellency, Mr. Cyril Ramaphosa, has elevated this program as highlighted in the State of the Nation address when he stated South Africa will achieve this noble objective of eliminating cervical cancer. In the next few weeks to come, we will officially launch a campaign for elimination of cervical cancer using the global strategy adopted by the World Health Organization with the targets of 90, 70, 90. In South Africa, I used to mention that we are already very lucky. Noting the severity of this disease, we started as far back as 2014 to vaccinate young girls for HPV between the ages of 9 and 15 at schools throughout the Republic of South Africa. We have up to so far reached 6 million school girls. We are very grateful for the report or the conclusion of the WHO that one dose is enough, because we're giving 2 doses every year since 2014, one in September, one in February, and the second one in October every year. We are very grateful to start the 1 dose vaccination campaign because of shortage of money. We were only targeting public schools in the Republic. We have taken a decision that now will go to even private schools and independent schools to reach more girls because now we have got more doses. So we have already started in our TV, in TV adverts around the country to announce our decision for the campaign to eliminate cervical cancer. Now, when we launch this program, we are going to put emphasis on the middle 70 and the last 90, which we know are very difficult. That's why we are going to put a lot of focus on the first 90 to make sure that we reach as many young girls as possible. We are so serious about this program that we've decided that the launch must be headed by the president himself. In other words, it's no longer the Minister of Health who is going to launch this campaign to end cervical cancer. It will be the president himself. So we are just waiting for a suitable date from the president. That's why I'm saying in the next few coming weeks, we'll be launching the campaign. We'll very much appreciate the help and support of WHO. Thank you very much.
Thank you, Minister Motsoaledi.
And unfortunately, DG, my apologies. I am today chairing a very important meeting of all the 9 health MECs or provincial ministers of health in our province, together with South African Local Government Association and South African Military Health Services. It is a statutory meeting for the country, and so I'll be asking to be released because I have just asked to be excused for a short time to come and attend this press conference. If you agree, DG, may I be released now, or if there are any questions which we need to answer, we'll answer them. But I will leave my advisor, Dr. Nonusi Milela, looking in to answer any questions, DG, if you agree.
Thank you. I know your busy schedule. We're actually very grateful that you joined us despite your busy schedule. So thank you so much. And I think Dr. Nono can address the questions if there are questions to ask. But we're very grateful, and congratulations for your progress on cervical cancer. And we are here to support you, and you have our full support. And the same also to Minister Nada, to India. Congratulations, like South Africa, for your progress. And we assure you that you have our full support. But we're very happy that progress is happening in the elimination of cervical cancer, which is a very important initiative that we started together, as you remember, some years ago. So thank you so much again. So I appreciate your leadership again, Your Excellencies. Thank you so much for joining us, to both Minister Nada and Minister Motsoaledi. Finally, WHO is deeply concerned about the conflict in the Islamic Republic of Iran and the Middle East, with 16 countries affected. So far, almost 1,000 deaths have been reported in Iran, 50 in Lebanon, 13 in Israel, and 11 in other Gulf countries. In addition, WHO has verified 13 attacks on healthcare in Iran and 1 in Lebanon. Under international humanitarian law, healthcare must be protected and not attacked. The conflict is also causing significant displacement. So far, an estimated 100,000 people have left Iran, and in Lebanon, more than 60,000 people have been displaced, and at least 1 million people may be on the move following evacuation orders in the south. The threat of nuclear facilities being impacted is also concerning. Any compromise to nuclear safety could have serious public health consequences. WHO is working closely with our offices in the affected countries to monitor the impact on the delivery of health services and provide support when needed and requested. But the impact goes beyond the immediately affected countries. Operations at WHO's logistics hub for global health emergencies in Dubai are currently on hold due to insecurity. To say more, I'm pleased to welcome WHO's Regional Director for the Eastern Mediterranean, Dr. Hanan Belghi. Dr. Belghi, thank you for joining us at this difficult time for the region, and you have the floor.
Thank you very much. Can you hear me? Dear Director General, dear Excellencies, Ministers of Health, and dear colleagues, the situation across the Eastern Mediterranean is indeed escalating rapidly, with serious consequences for civilians and health systems. Across the region, more than 1,000 people have reportedly been killed and 7,000 injured. One of our most serious concerns is attacks on healthcare. In the past week, WHO has verified 13 attacks on healthcare in the Islamic Republic of Iran and 1 in Lebanon. In Lebanon, evacuation orders have forced the closure of 43 primary healthcare centers and 2 hospitals. Violence has also affected the first responders, with paramedics killed and injured. At all times and in all places, health workers, patients, and health facilities must be protected, even in war. Last year, WHO's Global Health Emergencies logistic hub in Dubai fulfilled more than 500 emergency orders for 75 countries across all 6 WHO regions. However, humanitarian health supply chains are now being jeopardized. The hub's operations are temporarily on hold due to insecurity, airspace closures, and restrictions affecting access through the Strait of Hormuz. This disruption is preventing access to $18 million in humanitarian health supplies, while another $8 million in shipments cannot reach the hub. More than 50 emergency supply requests from 25 countries are currently affected, and $6 million in medicines for Gaza and $1.6 million in polio laboratory supplies are also held up. Half of global humanitarian needs are concentrated in the Eastern Mediterranean region. We are coordinating the health response across affected countries, supporting ministries of health and partners to sustain essential services, as well as strengthening disease surveillance and preparing for potential mass casualties and displacement. WHO is also pre-positioning trauma supplies and essential medicines, supporting countries to maintain critical public health functions, as well as scaling readiness for chemical, biological, radiological, and nuclear risks. Yet our emergency operations across the region currently face a 70% funding gap. Without urgent financial support, essential services will cease and preventable suffering will deepen. However, WHO remains committed to doing all we can for the people of this region and all regions of the WHO. Thank you very much, and back over to you, Dr. Tedros.
Thank you, Dr. Belghi, and thank you for your leadership at this critical time. As always, the best medicine is peace. And Christian, back to you.
Thank you very much, Dr. Tedros, and honorable ministers, as well as our regional director. I think you understood that Minister Motsoaledi and also Minister Nada will both not be available for question and answers, and we thank them for their contribution. Now, we're ready for your questions, and I understand the first question is from Associated Press, Jamie Keaton. Jamie, please go ahead and unmute.
Thank you, Christian, and nice to see you all again. My question is for Dr. Balkhi. Thank you so much for coming to see us. It's so good to see you again. You mentioned the 13 attacks on healthcare in Iran and one in Lebanon. I was wondering if you could give us a little bit more detail as to what those involved, and what you did also mention the disruption in preventing access. What particular concerns do you have about the provision of healthcare in Iran specifically right now because of the violence that's happening there? Thank you.
Yeah, thank you very much, Jamie. Let me look at our regional director, Dr. Balkhi, or the regional emergency director. Let me see.
Yes, thank you very much. I'm happy to take this question. Of course, the attacks on the healthcare in Iran since 28th of February, and according to the head of National Emergency Management Organization, there's 4 healthcare workers that have been killed, 25 health workers have been injured, and 4 ambulances have also been damaged. 11 hospitals and 6 pre-hospital emergency posts were affected in the past 5 days. So most of the health facilities is due to their proximity to these target sites. No structural damage has been reported, only minor damages. When we talk about the healthcare system provision and the support that we provide to our member states in such a situation, we are there. We have an office, a country office present in Iran with staffing at the moment. And I think that we have not received formal requests for any specific supplies, as their system is withholding and withstanding the current situation. However, we remain in close communication and contact with the healthcare authorities in Iran and in all of the affected member states within this region to provide the support that is needed.
Thank you very much, Dr. Balkhi. Next question goes to Emma Farge from Reuters. Emma, please go ahead and unmute.
Yes, good afternoon. I was wondering if you could say more about the disruptions to supply chains. You mentioned your Dubai Humanitarian hub. Can you say who those supplies were destined for, in what places of the world, and what needs are they catering for, which diseases or which injuries? Thank you.
Thank you very much, Emma. Dr. Balkhi, you want to go ahead?
So many of the, I'll give this to Dr. Annette in a minute, but many of the supply chains that goes through the Dubai hub are emergency kits and non-communicable disease kits, but also many other consumables for the healthcare systems within the region and also within other regions of the WHO. The emergency kits that usually are exported out of the Dubai hub are pre-placed in many of the countries facing emergencies and conflict. They are supplies that can last for 3 months to support 10,000 individuals, and they include the necessities of any healthcare system that are needed in a case of conflict. Some of the commodities also are important to go to countries that are in need of the polio diagnostics and kits and so on. And those are because also our region is still including 2 member states that have endemic polio or wild polio in Afghanistan and Pakistan. And the delays in the delivery of these kind of necessities to our member states will definitely have an impact on our ability to respond and address the issue of poliomyelitis, but also not only in the 2 endemic countries, but also in other countries in this situation. Some of the kits that also flow into the Dubai hub and out into the member states are non-communicable diseases kits that support the healthcare systems in addressing and managing the commodities that are necessary for managing diseases such as hypertension, diabetes, and chronic diseases. I don't know if Annette would like to add anything to that, or? No, okay. Thank you very much.
Thank you very much to the regional director. Next question goes to Stéphane Bussard from Le Temps. Stéphane, please unmute.
Yes, hello. Thank you for this briefing. I have two questions. The first is, after the reforms and the austerity measures that WHO has taken, what signals, Dr. Tedros, do you have from member states as far as WHO? Is it still perceived as a key multilateral organization? That's my first question. And the second is, we have in Geneva a global health ecosystem with Gavi, Global Fund, and WHO. And how important is, even though it has been weakened, how important is this ecosystem for WHO? Thank you.
Thank you very much. Are you referring, Stefan, to the Middle East conflict now and the more global context, just to get
More
that
global
straight?
context, yeah. Thank you.
So I'm not sure we have anyone today who wants to jump in on this, or do you have Dr. Jeremy Farrar? Okay, Dr. Jeremy Farrar, Assistant Director General for Health Promotion, Disease and Prevention and Care. Thank you.
Yeah, thanks, Stefan. I think we spoke recently on a similar issue, Stefan, and actually I just have come from a member state consultation around global health ecosystems, and I have to say the enthusiasm that was there and the commitment to continuing to work together in multilateralism was palpable and very strong. And we had also at that member state consultation some really constructive interventions from the organizations you name, Gavi, Global Fund, UNICEF, and many others, for which we're incredibly grateful. Everyone knows there's a lot of discussions going on at the moment about the ecosystem. WHO has a mandate from our member states to host inclusive and diverse consultation on this over the course of the next 8 weeks leading up to WHO. And I have to say I'm very enthused by the consultation we just had.
Thank you very much for this. We move on to Elaine Fletcher from Health Policy Watch. Elaine, please go ahead.
Hi, thanks for taking my question. You mentioned the attacks on healthcare in the region since the 28th of February. I'm just wondering, has the WHO done any tracking of the alleged attacks on health workers during the mass Iranian protests in late December and January, when, according to many reports, regime forces were entering hospitals, attacking and even arresting and killing both doctors and patients? And secondly, can you hear me? Is it okay? And secondly, just during the current war, there's also reports that the regime has stationed itself in some hospitals and schools. Have you got any information on that or any comment? Thank you.
Thank you, Elaine. And I guess we'll look at maybe at the Regional Emergencies Director, Dr. Annette Heinzelmann, or Dr. Balkhi.
But can she repeat the second question, because we didn't hear her second question, please?
If I understood well, it's whether any forces have established themselves inside hospitals, whether there's anything on abuse of medical facilities for military purposes.
I've seen.
Yes, you can share.
Yeah, over to you if you can.
Yeah, thank you very much for the question. So during the events you are alluding to, we were able, so the situation was quite difficult. However, we were able to verify some of the incidents, and they are the information is available on the dashboards on attacks on healthcare. With regards to the second question on this, we do not have information, and we cannot confirm these events. So, thank you.
Thank you very much. Next question goes to Richard Horton from The Lancet. Richard, please go ahead and unmute.
Hello there. Thank you very much indeed. A question to Dr. Balkhi, please. You mentioned that you are mobilizing support for the Ministries of Health in the region, disease surveillance, and also preparing for mass casualty events, scaling readiness. Could you just give a little bit more detail about your plans for supporting Ministries of Health, disease surveillance, and scaling readiness for mass casualty events? Thank you.
Thank you, Richard, and great to hear from you. Of course, this work does not start during this current conflict. I think, as I mentioned, the WHO has offices in all of the actually 21 out of the 22 member states. The only country that has a desk office is the UAE, United Arab Emirates. Otherwise, we have country offices in all of the 21 of the 22 member states of the Eastern Mediterranean region. The work that the emergency program, and Annette can elaborate maybe a little bit after my intervention, is that we work with our member states depending on their healthcare system and their situation on preparedness and response as well. So during the peacetime, prior to all of these conflicts happening or these most recent escalations, there has been already a communication on understanding the healthcare system of the country, making sure that their supply chains are intact. I can give you an example. In Lebanon, we have been in a way lucky because before the current escalations that is even escalating this morning, from the previous warnings that we had pre-placed some of these emergency kits in Lebanon, and they are serving us very well at the moment. We do, in preparing the member states for such conflicts and also for natural disasters, which also happen in this region, to pre-place these emergency kits. Number two is that one of the several priority activities that take place in the emergency countries is to establish a surveillance system. If they don't have one, then the emergency teams, and we do have team heads for emergency in each of the countries. So apart from the head of the office, we have an emergency team lead that works very closely with the Ministry of Health. And if they do have a functional public health authority, they would be working with them. If they do not, then specific EWAR systems are established to help detect emerging and re-emerging pathogens. Because the biggest worry is when these conflicts take place, then the healthcare system will be affected. But not only that, the infrastructure of the country will be, or the cities, the communities will be affected. The potential of contamination of water, emergence of communicable diseases can create risks of outbreaks of common diseases and even some of the rare diseases, as we've seen in Gaza when polio re-emerged. So these are some of the basic work that we do, as well as making sure that we are able to verify, and the healthcare system, maybe to verify a little bit of that. We do not verify the casualties ourselves or alone. We do that in support of the national authorities and other humanitarian partners on the ground. And as Annette said, that is published on the website. Now, so a lot of the work is done prior to the conflict. During the conflict, then we have to work with other partners, and again, with what we have existing. There are times, and that's why we're very much hoping for this conflict to stop sooner than later, because we worry that the supply chains will be further strained, and we will be losing the capacity to provide the help that is being provided at the moment. There's another concern that worries us a lot is the displaced populations that are taking place. It's already taking place in Lebanon. And Iran, people are being displaced as well. And that also puts pressure on already, for example, in Lebanon, on already fragile healthcare systems that may not be able to accommodate. So we expect that these conflicts will lead to more hardship and more pressure on the healthcare facilities. I don't know if Annette, you want to add anything? Thank you, and back over to you. If there's further elaboration, I'm happy to do so.
Thank you very much, Dr. Balki, and we'll go to Ian Clark, Incident Manager for the emergencies.
Thanks. So maybe just the Dr. Balki mentioned Lebanon, but maybe just to say, to expand on that. I mean, I was there as the Deputy Incident Manager supporting the country office, and really considerable work was done prior to the incident when the pages all exploded. A lot of work was done around trauma training, as the RD mentioned, around pre-positioning, but then also, specifically for triage at all of the main centers and hospitals. So, this really paid off in terms of the actual impact of the response. We saw, how the Ministry of Health and the hospitals were able to manage those sudden influxes of mass casualties. And of course, that's going to be critical now as we go forward in managing the health situation in Lebanon. But that's not just for Lebanon, that's just a case example of some of the work that was done that the RD had mentioned. Thank you.
And thank you, Ian Clark. Next question goes to Christiane Oelrich from the DPA. Christiane, please go ahead.
Thank you, Christian. My question is also to Dr. Balki, and it's on the Dubai hub. I don't know whether you mentioned it when I didn't hear it, or maybe you didn't mention it. How many people are actually impacted because supplies cannot be delivered from the hub? And what is WHO's plan B if this hub is not available for the near future? Because there are no guarantees that Dubai will become functionable again in the next 2 weeks or so. Thank you.
Thank you very much. I think we'll have Annette answer that, and then maybe I can come in, or Ian. Over to you.
Thank you very much. So the impact in terms of population is difficult to estimate right now, because it will depend in the end on the question how quickly the hub is functional again. But however, we have alternative plans. So currently, we are working in close coordination with the authorities in Dubai, also with global and regional partners, and with WFP and UNICEF to look for other solutions. So there are potential solutions to provide supplies through land routes, which we are currently assessing, instead of air transport or shipments. There we are also assessing the possibility to work through our other WHO other logistic hubs, notably in Nairobi and in Brindisi, which are close to the region, but also we are working together with our logistic hub in Dakar to look into alternative shipment routes. And also there is the potential of local supply sources, which we can then use and have shipments through land routes to the different country. For sure, there are some countries where there are higher administrative and logistic barriers to address than in others. For example, access to, for example, Afghanistan is highly complex. However, we are looking into very, very viable solutions in the coming days or in the coming week for some affected countries in the region. Thank you.
Thank you very much, Dr. Heinzelmann. And just to clarify, this was Dr. Annette Heinzelmann. She's the Regional Emergencies Director for the Eastern Mediterranean region. Next question goes to, hang on, to SABC. That's Sandile Mjesa from the South African SABC. Sandile, please go ahead and unmute.
Thank you very much. Am I audible?
Very well.
Thank you. My question is with regards to the cervical cancer progress in South Africa. The HPV vaccination program in schools. I'd like to find out what has been the community engagement with parents and community members, particularly around health literacy, around the importance of HPV vaccinations. We've seen in the past there's been vaccine hesitancy, and I'm just trying to get